what should we focus on as African institutions to promote diversity, equity, and inclusion in our higher educational institutions. We have two very experienced disability inclusion professionals with us who will be leading us through the different exercises. I would take a few minutes to introduce them before they take us through the process. We have Ms. Marike Borsima, who is Head of Program Quality Innovations at Light for the World, where she has served previously as Technical Director for Community-Based Rehabilitation Program. She received her first degree in physiotherapy from the University of Applied Sciences, Leyden, and a Master of Science degree in Medical Anthropology and Sociology from the University of Amsterdam. She joined the University of Gonda. It has been a pleasure to work with her here, in 2002. And she had worked to establish the Department of Physiotherapy, launched the first ever community-based rehabilitation program in Ethiopian higher educational institution, and designed projects that benefited communities in and around the city of Gonda. She has also worked, after leaving the University of Gonda, with Enablement, an organization committed to the cause of CBR, community-based rehabilitation, and disability inclusive development. In addition to these professional experiences that she has co-chaired the CBR working group of the International Consortium on Disability and Development, and served as a board member for CBR Global Network. We're happy to have her here and listen to her notes. Mr. Malaku Takle is Disability Inclusion Advisor to Light for the World, where he spearheads the facilitation of organizations programming on full and effective inclusion of persons with disabilities. His educational background includes two BA degrees, one in Public Administration and Development Management and another one in Law, and one graduate degree in Social Work. He is ILO certified training of trainers on managing disability inclusion in workspaces and inclusion of persons with disabilities in organizations. He had served as executive director for the Ethiopian Center for Disability and Development before he joined Light for the World. And he had different professional experiences, and especially in building capacity of higher educational institutions to include students with different types of disabilities, and provide trainings and other supports to empower university students with disabilities. And this had been undertaken, a plan and undertaken in collaboration with Finnish University Students Association. His professional interests ranged from institutional and systemic change to personal development of persons with disabilities in areas like education, workspace, community living, and independent living. Thank you, Mr. Malako and Ms. Marike, for joining us. This is going to be an exciting, interactive session. I look forward to it, and I'm sure that everybody is also looking forward to it. And I hand over to you this session, to your capable hands.
Thank you, Dr. Mikias. It's great to be back, even though at distance, with Gonda University and all other universities today. I would like to ask Dr. Mikios, or one of the technical people, can you share the presentation that we prepared? On behalf of Malako and myself, we are really happy to have this meeting with you today. And we were very honored that Gonda University asked us to support you in this session and lead you through this session today. For Light for the World, the journey of measuring and assessing equity and inclusion started with a project called Count Me In. Next slide, please, Malako. It is roughly a decade ago that we had a project together with different organizations to see how they could better include disability into their organizational level. And our experience since then has been, if you assess, if you count, if you find out where you do and do not include, you also know better how to improve in terms of inclusion. Our experience is specifically in the field of disability. For this session today, we went a bit beyond disability and also looked into gender on purpose, because it's not our expertise. We did not include the topic of ethnic minorities because we felt that we would do a poor job at it, and we would very much welcome in the discussions those who have experience in that field to also share their experience about that. So from Count Me In, we developed a tool called the DEISC, the Disability Inclusion Scorecard. And that has formed the basis for what we are doing today. Can you show the next slide, please? So very roughly, and you don't have to see the details of this, but the DEISC is a tool that looks into different areas and then scores on 4 levels how far you have reached in terms of disability inclusion. And then the last slide, please. What we would like to do today is do a teaser with you, and we hope that in the future, especially in our collaboration between Light for the World and the MasterCard Foundation, we can support your different institutions to actually do a proper DEISC assessment within your organization. What we did today is choose a few questions as an assessment teaser, so that we can have a general discussion about what do you know already about the inclusion level you have reached in terms of students with disabilities and gender in your organization. We have divided it into 5 sections. 1 is an introduction question, and after that we go into 4 domains, 1 around strategy and human resources, 1 around student enrollment and accompaniment, 1 around curriculum, and 1 about accessibility. And each one of those domains will have 3 questions. For these questions, we will use a tool called Mentimeter. So you will receive, you will have to go to a website called menti.com, and you will receive a code that you will enter, and then it will lead itself. You will receive a question, you answer the question, and we will see the results of all your answers, and then we'll have a discussion about it. So we'll have a different, at each domain, we will have some time to discuss and ask questions about it, have comments about it, and then we'll move to the next domain. Melako, any additional comments from your side before we jump into Mentimeter?
That's it. Thank you, Marieke, for the wonderful introduction. And one more thing is for each question, we will give our participants 2 minutes. 2 minutes will be provided for each question, and each domain will have 3 questions, as you rightly put it.
So with that, we move from our presentation to Menti, and I'll give the lead to Melako to do that. I hope you can all see the screen now. So you go, the link was also put into the comment box. So you go to menti.com and you enter, can you go back to the former, or you can't now, Melako. In the comment box, you will see the code 30835214, and then you should be able to go into the question. And just for clarity, so the first question is about ranking your university most pressing disability inclusion challenges. And you get 5 options, and we would like you to say from 1, what is the most pressing, and 5, what is the least pressing challenge. So the scoring is as follows. All of you score that low enrollment and performance of students with disability is your largest problem. The issue you rate next is the low awareness on disability among staff and students, followed by no strategy or policy on disability inclusion and services, and lack of accessibility and exclusion criteria within the curricula. And the last one, which you rate as least problematic, is inaccessible physical environment. So there are no ramps, rough surfaces, etc. Is there any comments in the chat? People who would like to elaborate on this? Yeah. So there is one comment from Awal Manna, who is saying that inaccessible or physical environment is rather the bigger challenge. So I understand that it's a different. So although the inaccessibility was scored the lowest in this poll, you feel that it's in your university rather the biggest challenge for people to enter the university. So thank you very much for that comment. I think what we will do is we'll go into each one of these categories and look into a few more specific questions around each one of these topics. So I hand over to you, Melako, to lead us through the first domain.
Thank you, Marike. Let me again share the first domain, the slide for the first domain, so that we will also see, what are the elements of related to the domains that we need to target. Similarly, we will have 2 minutes for this, so the countdown will start just now, and you will find the link for the strategy and human resources management. So there is a link. You can follow either the link, or on the top of these questions there is a code. You can use either of the two. And similarly, we will have 2 minutes for this, and we will continue our discussion again. So the first question here is there a mandate from the top management to promote and monitor gender equality in programming and implementation? So it's more of a kind of a strategic look into the gender equality programming and also implementation. So this is the first question. Votes are coming up, and keep it coming. So we have about 40 seconds to complete this task. Then once we are done with this, we will proceed to the next one, to the next question under the human resources and strategic documents related domain. So far we have 8 people voted. Yeah. Okay, thank you for voting. So we will go to, since there are 3 questions under this domain, we will proceed to the next question, and similarly we will have 2 minutes, and we will finally wrap up all the questions, all together. So let's go to the next question. Similarly, you will have 2 minutes. And So you can use the same link for this as well. These questions are meant to, look back to our respective institutions and see where we are in different domains. So the current one is related with strategy and human resource management. Yeah. So the voting has been closed, and we will proceed to the next question and the final one under this domain related to human resources and strategy. Here you go, the third question. So also here you have 2 minutes. So this is related with, it asks, are persons with disabilities working in the institution as a staff? It can be part-time, full-time, academic, administrative, board members, volunteers. So let's see where is your institution in this domain. We are seeing very interesting responses. There are some with none of the staff, board members, or volunteers have disability. We see most of the responses are from 1% to 2%. Thank you so much, everyone, for voting. So what we are going to do now is it will be open for discussion. But first, let me take you back to our very first question, which is related to, which asks us about, is there a mandate from the top management to promote and monitor gender equality in programming and implementation? It looks like we have 2 equal, like a draw on 2 points, which is there is a broad strategy to promote gender equality. It doesn't clearly identify short to long-term targets, and also it doesn't drive day-to-day behavior. But also on the other side, there is a clear, coherent, and actionable strategy that identifies short to long-term gender equality promotion and monitoring targets. This is by far the highest level, and the ideal aspect of it in the institution. So luckily there is no institution or among our participants who voted there is no or unclear top management mandate on gender equality programming and implementation. Also, promotion and monitoring mandates from director or higher management on gender equality is non-existent or unclear. This is very good, but let me give the floor to you, and where, maybe if we start, where do you see your institution in relation to other voting institutions, and what do you think when you see this, and what come to your mind? Probably let's give the chance to our audience here quickly. Where do you really see your institution, in this aspect of it, in the strategic planning, and also in the human resource related domains? Or maybe on which segment, on which question did you rate your institution very well? Maybe you can also share us your insight on this.
Yeah, I think, thanks, Malaku. I think that, so for me, Gondar University is the higher education institute I know best and most. And I think that there are 2 aspects to, especially this last question of having staff or people with this, is that the year already starts investing because of it, and it's also an encouraging example for students with disabilities to join the university. And I think it would be nice also, maybe as we move to the next question, to maybe encourage Gondar University to come up with some examples of what they've done, because I know a lot of work has happened at Gondar University to improve the inclusion and of students and staff with disability into the institute.
Let's proceed to the next domain, right, Marike?
Great. Yes, Milako, let's do that.
Okay.
Probably.
Yeah. Dr.
Yeah,
Yes, go ahead.
I wanted to keep commenting on the institution here because I'm moderating, but just to make a few notes on students' participation in staff. We have a policy, for example, in admission and enrollment and staffing, where there is a quota system for staff to apply, and then that quota enabling individuals with disabilities. Of course, they have to meet the basic requirements, and involving persons with disabilities in programming, decision making, activities has been the experience here at Conta.
Thank you, Dr. Miki. Yes, that is wonderful to hear, and also I'm sure, even if you are of course moderating part of this session, but we will be, and also the audience will be very happy to learn, what you do at the University of Gondar, as it is the leading university when it comes to disability inclusion and diversity in the country. So without further ado, let's proceed to the next domain. I will share my screen so that you will vote. You will share your insights. Yeah.
There we go. So we have 6 from the people mentioning that there is no discrimination, but there is lack of special provision. And we have 4 voters that say there are special provisions. Students with disabilities have, with that, little or no difficulty to be admitted into the university. Thanks a lot. Well, Milako, while you move to the next question, I saw you put a comment into the chat. In my institution, there is a positive discrimination in the sense that there are special concessions for students with disabilities. That is great news. Can you maybe also add in the chat which university you're from? That would be nice to know. So we have moved to the next question. And the next question is around the student admission criteria enable the enrollment of female students. So we're looking at gender now. So thank you very much. And we move on to the last question in this section. This is about counseling. So this question is about, are the professional counselors qualified and knowledgeable of the psychosocial and emotional attributes of diverse identity? So whether that is disability or the differences in gender or people from minorities, are the counselors aware of this, and do they have are the counselors present in the first place, and if they are they trained well in diversity? And as we have the countdown, I think this is a topic very near to my heart. Not so much in terms of students. I have more experience with children under 18. And I think it's very important when it comes to diverse identities to realize what the effect is of exclusion on the self-esteem and the different factors, how a lack of inclusion makes us all more vulnerable. And definitely in the case of girls, women, children with disability, etc., that's definitely an issue that needs to be addressed. So very good to see that in most of the universities, There is an availability of counselors, and not only are they available, they also are trained well on and knowledgeable on the psychosocial emotional attributes of diverse identities. So looking at these three different questions, and maybe you already put a comment in the chat. Would you like to share some of your experiences around this from your university in Ghana? That would be much appreciated.
Sure, I would. I mentioned, I think, in an earlier session that students with disabilities are identified when they are applying to the university or on the application form. They have to indicate if they have a disability and what disability they have. And once they do that, they are invited for a pre-admission interview, and we interact with them. And we have special concessions. Once they have the minimum requirements, they are admitted automatically. Their counterparts may have the minimum requirements, but because of limitations in terms of numbers, they may not be admitted. But once you have a disability and we can assess and show that you do have a disability with minimum qualifications, you have automatic admission into the university. That's the first concession that is given. And then there's special consideration given for maybe what they want to study. So they may not have the minimum requirement for that particular field of study. Let me take an example, law. In our law program, the minimum requirements are very stringent, but if you have a disability and you have some proven capabilities, then we would make a case that you are admitted into that program, since that is what you want to study, for example. So there are decisions taken based on our interaction with these individual applicants to come into the university. And there are some special concessions given for certain requirements. For example, students with visual impairment are exempt from the pass in mathematics, for example. So all other students who come into the university must have a minimum pass in mathematics, but they are exempt from that, for example. So so these are specific concessions that are given to ensure enrollment of students with disability. So
Thank you very much. That's really good to hear. And thank you for sharing those experiences. I think it's very important to have those special provisions. And I think that combination between, yes, admission is really important, but then also to have the support like counselors, because if you are admitted but don't get any support to catch up, then you drop out often as fast as you were admitted. So thanks very much for sharing those experiences from Ghana. Very encouraging. Araba, you have raised your hand. Do you want to come in?
Yes, Marieke, I do. Similarly, at Ashesi University, we do make affirmative action to some extent. The application forms will ask whether you have a disability that may or may not affect your study and your stay at the university. Once we gather that information, there are two pivotal areas. We have qualified psychotherapists, and we straight away put you on their list. So they have an initial one-on-one engagement to find the extent of the problem and how we can support you in your journey. The health center is another touch point that we pass them on to. So they may even require further evaluation to see the severity of whatever disability and what we can do. And in cases we've had the IT team, when we've provided a laptop, we may have to give a special laptop to that student with visual impairment. There have been cases we've asked for extension of exam time for some of the students with disability based on their needs. So yes, we do have the general admission criteria that enables them to come in, but we take it on a one-on-one cases once they are admitted to work with them to ensure that they succeed and they're well taken care of too. Thank you.
Thank you very much. That's very encouraging to hear, and great to have this sharing of experiences from our different universities. And you're right, it's good to have the support as soon as the students are enrolled into the university, and make sure that they get the support they need in order to succeed in their studies. So I think it would be good to move on to our next domain. Melako, the floor is yours. And I just see that Dr. Mikias has shared the link to the next domain in the chat.
Thank you, Marike. Super. Okay, let's proceed to the next presentation, which is accessibility, as you rightly put it. I will shortly share the questions on my screen. Bear with me. Yeah, it's very interesting to see institutions earlier, or they don't see accessibility as that much a challenge, because as a person with physical impairment myself, and also, you know, during my university days, I used to really struggle a lot about, you know, on infrastructural accessibility, especially classrooms, and, you know, a number of locations within our university. And I am sure we will be able to pick these topics later on when we discuss about them, because, you know, accessibility is the most important entry point. I mean, even if the curriculum is accessible, if the infrastructure is not accessible, students may not be able to, you know, access education at all when it comes to the physically impaired students. Yeah, so sorry, my network is a bit slow, but I'm trying to catch up. Yeah, here we go. Domain 3, accessibility. Yeah, just sharing my screen now. Yeah, here you go. Similarly, we have 2 minutes. So we have 3 questions under this domain.
Malako, if you could add on what we mean by accessibility and issues like that as participants vote.
Yeah, when accessibility of infrastructures, we meant by, you know, different facilities, classrooms, offices, dormitories, canteens, laboratories, you know, whether they are reachable to by students with disabilities. Especially this question is related with the physical infrastructure, but as you know, accessibility is much more broader, and you know, some of the other questions will address other dimensions of accessibility, like sign language interpretation. That is also one aspect of it, you know, and other dimensions of accessibility are there. But this question is related with the infrastructure, accessibility related with the institutions, classrooms, and the like. Yeah, so we have about 30 seconds, and we have 8 votes so far. I think we expect more, but most of the votes are, almost all infrastructures are accessible to persons with disabilities. This is very, very interesting to see. Yeah, and some are main infrastructures are accessible to persons with disabilities. Okay, so this one is closed. Let's go to the next, but mostly it shows that most of infrastructures are accessible. It says so. Let's go to the next one, and we will discuss this later on. So this one is related with the question is relevant information disseminated to students in accessible formats and channels, that is website, newsletters, notice board, audio visual media, because as you know, when it comes to the disability is not it's not a homogeneous type. There are different types of and levels of impairment for persons with disability. So our accessibility is our consideration needs to consider all persons with disabilities with different types of impairment. So yeah, since you have already responded to these questions, I will stop it here and take it to the next question if you didn't do already. Yeah. So is sign language interpretation available in institutional activities? Yeah. So sign language interpretation, the options are no sign language is available, sign language is available for students on demand, and also sign language interpretation is always provided as an option. So as you know, mostly deaf people rely on sign language interpretation, and also this is a right which is enshrined under the United Nations Convention on the Rights of Persons with Disabilities and many of our domestic laws in country and also around the world. When we see the responses, most among three of the responses are no sign language interpreter is available for students, staff, or clients with need for the service, and sign language interpretation is available for students only, because there could be also staff and even clients who would need that service. So two of responses are this, and only one institution is always provided sign language interpretation as an option, and another one is sign language is available on demand for staff and clients, but it is readily available for deaf students. So probably it would be interesting to hear from you on this different dimensions of accessibility, especially on the building, inaccessible building, and sign language interpretation. So what is your experience, and how is it helpful to ensure inclusive education in our higher education institutions in Africa? And where do you see your institution in light of these questions? Anyone who'd like to share his or her reflection on this? And I will come to Millicent's question. I will come to that question in the meantime. So maybe Solomon, the floor is yours.
Thank you, Malaku. We have a sign language interpreter for the class while the students are in the class. The challenge here is the student require a sign integrated or communication with other students outside the class. So they demand in communication with administrative, like registrar office or other officers. So we cannot address by assigning 2, 3, 4 sign language interpreter. So what's the only possible, the best possible option is, we suggested to train at least basic sign language training for those who are directly involved with the students, like, admin staff who are involved in the library, in the classroom, as well as in some part. This is a really very tough and challenging situation because, if you have 5 students having a different department, then you need to have a 5 sign language interpreter, which is resource consuming. So just, from our experience that we observed that with increasing the number of hearing loss students, we are highly challenged to make available for each of them while they are distributed in different departments, and while they need something, from a different service, like, from the library, laboratory, and the like. So what we usually use is, we use only in the classroom at this point. Thank you. Over to you.
Thank you so much, Solomon. It's very, very interesting experience. I know, I totally understand the challenge. Maybe there is a very interesting also question, which is from the chat room. So probably we can quickly maybe Awo, let me give the floor to you so that you can address that question from Milton. Please, yeah.
I will. She was wondering if we've ever had to turn a student away at the pre-interview assessment because we couldn't provide support. And at least in my 6 years of experience working in this office, we've never had to turn a student away because we couldn't support them. What we've had to do, though, has been to offer them alternative courses. Because if a student with a specific disability wants to pursue a course where maybe the leadership of those departments feel they would not be able to cope, then we would have to offer them something else. And I give the example in the chat of a student who had a lower limb problem. She had problems with her feet. And so the head of nursing felt she would have difficulty with long hours of standing, which is part of the demand of the nursing program and the profession. And recently, a rather heartbreaking one was a student who was in a wheelchair. He is in a wheelchair, and he was interested in doing laboratory science. And we had to admit that our laboratories at UG are not very disability friendly, and most of the what are they called, the tables they work on with their equipment are high up, and so he wouldn't be able to work in the laboratory. And so we had to offer him his second choice, which was computer science. So those are the kinds of things that happen. Another case I can think about was a student who is a paraplegic, but she, we realized, could not survive on campus on her own. She would need somebody with her 24/7. And so what we recommended instead was that she enrolls in our distance education program because it would be very difficult for her to survive on our campus on her own. So that was those are some of the things that we have to consider. But we've never had to turn a student away, at least so far in my experience. Yeah.
Thank you so much, Awo. Thank you so much for sharing your experience. The other dimension is, I think, when do we need to assess? In my opinion, of course, on the assessment, of course, we will have to do prior assessment to some extent, because to understand, what kind of adaptations that we need for the student. I know many institutions, including even in outside Africa, they do preliminary assessments. Also, after the student is on board, looking at the situation closely, they may consider at making adaptations and along with the student himself or herself. So I would from the experience I would say. Preliminary assessment or initial assessment is very important, but also, it would be also good to really not to leave it there, so that continuously engage with a student together, so that as much as possible to adapt and to make sure that the student is included very well, and most of the the learning and the social environment is also accessible. Maybe one more question to you, Dr. Solomon, from Rose, if you able to catch up on the chat box. It says, has Gondar explored sign language technology, something that would allow students who need it to carry it along to groups, meetings, for example? does such technology exist? This is a question from Rose.
Yes. In the University of Gondar have a hospital, a referral hospital, one of the big hospital in the country. They assess the hearing capacity, and there are chances, to have an additional hearing device that can support, to hear. So what we did is, we do that assessment, and the challenge is, availability of the instrument in the country. We have very limited suppliers, but the capacity and just the actual type of the instrument is not available in most cases. But we have an aid that can assist them to improve their hearing capacity. So we usually do that. And the challenge we have is, since the scholars at the beginnings are persons with disability, we assume that there is limitation of hearing. They don't want to share us, their status of hearing, whether they completely cannot hear or they're partial or whatever. So but after discussing with them for their benefits, they are willing to be assessed. And yes, definitely, Rose, we have that assessment material, but the challenge is getting the equipment from Ethiopia, especially in the country.
Okay, super. So let's proceed to the next domain, which is related with curriculum. Of course, curriculum is very important to make, one dimension of inclusiveness in the higher education. So similarly, we will have 3 questions under this, and the floor is yours. This time responses are coming very quickly. That is wonderful. So the question is, are teachers equipped with skills and attitudes to teach students with disabilities, taking into account their special needs? So we have 4 options. So far, we have 3 responses for teachers teach in a classical way and do not adapt their teaching materials and approach to students with disabilities or students with special needs. The second is some teachers know how to adapt teaching methods to meet the needs of some students with disabilities. And the other is most teachers know how to adapt teaching methods to meet the needs of some students with disabilities and actively use their students or persons with disabilities. And finally, all teachers know how to adapt teaching methods to meet the needs of all students with disabilities and able to communicate with deaf students. It is rated 0 so far. No one is voted for it, and it is ideal. It is clear that this is a much more higher standard that we need to achieve someday. So we will close this question in about 10 seconds. So now also you have 2 minutes, similar with the previous one. This one is related with our teachers equipped with skills and attitudes in gender equity. So this is related with gender equity. And we have 3 options. Teachers are not aware of their attitude and role in gender balance. Teachers understand gender equity, but do not have the skills to adapt their classroom management and teaching to address gender equity gaps. And the third is teachers understand gender equity and have the skills to adapt their classroom management and teaching to address gender equity gaps. So far we have 71%, 63% of responses are on this higher level standard of gender equity. Okay, so the vote is closed, and we will go to the final one under this domain. So you have similarly 2 minutes to share your insights on this and where your institution is. This is related with the question is monitoring data collected on gender and gender analysis built into your monitoring procedures. So you have 2 minutes to respond to this question. Leon and Awo, I will give you the floor also to share, the experiences so far. I'm following your responses under the chat box, but at some point it would be good to start with and to have a chat, to discuss on these good experiences. Yeah. So it is, so far we have 4 responses on this, and most of it is all programs collect gender disaggregated data and collect gender analysis. This is really encouraging. The second is with 2 votes, some programs collect gender disaggregated data, some programs conduct also gender analysis, and the other is some programs collect gender disaggregated data, no program conduct gender analysis. So gender lens has not been looked into, some of the institutions that we have. Any, be it gender or disability disaggregated data is important, as you also early on, as you rightly noted out, during even enrollment or at any phases of education. If we have the right data, it will be relatively easy to plan and also budget. So unless something is really counted, there is no way that it could be included. So our vote is time is up, is closed, and before we go to the details, let me give the floor to first Awo. Because I was following some points on the chat box. So then we will take it further. Awo, the floor is yours.
I was talking about the curriculum and whether our teachers adapt their curriculum and teaching styles to suit our students with disability. That is a difficult one. Getting our faculty members to adjust is always a problem. And so we have made efforts to have workshops to help them see what they should be doing. And sometimes they're not well attended, but we have every year there is some kind of orientation for all heads of department and deans, and our office is invited to give some information on how faculty members can adjust their teaching methods and their provision of information for our various levels of students, and letting them know, for example, if there's a student in their class who's profound deaf and needs to sit in front of the class and have access to a sign language interpreter, how their attitude should be towards that sign language interpreter as well as the student. And the fact that we sometimes also ask for recordings of lectures that are ongoing, so they need to give permission for lectures to be recorded. And for the profound deaf particularly, it's quite an expensive agenda, because for each student they need 2 people at every lecture. We have note takers to take notes for them, and then the sign language interpreters as they interpret the lecture. So faculty have to be aware of this and be tolerant of other people in their class. And so it's it's a work in progress. As I said, we continually try to get our faculty to see and even to make adjustments. One of the biggest challenges I have with faculty sometimes is when we have alternative examination arrangements for our students, and therefore the examination scripts of our students have to be treated differently, and sometimes they get missing and they are not I don't know how to put it, they are not very responsive to our attempts to get them to do the right thing by our students. So it's difficult working with faculty sometimes, but it's work in progress, as I said.
On this also very topic, Leon, I think you were sharing related with experiences at Kepler. So would it be possible to hear from you?
Thank you very much. So I was saying that I'm Leon Laura Uwizihiwe, the D&I manager at Kepler. So I'll talk about the experience with students living with disabilities and gender related. So at Kepler, this year was our first year to admit students living with disabilities. So we are still in the learning process. We are still making mistakes and we are still learning from them. But so far, we have made sure that staff and either operations and faculty are aware of the admission of students with disabilities, and they were involved in the admission process. And we made sure that they are onboarded on how to offer special education and how they are going to support these students. So we started with the disabilities that we can accommodate, to mean that this means independent students, even though they live with disabilities. So we are planning to grow on each intake to increase the number. We are working with the National Council of Persons with Disabilities. So they support us into the admissions. They disseminate information, and we do outreach to get to them. And for gender, at Kepler, gender is very much observed. First of all, we admit students on 50-50 gender balance. We are also striving to get gender balance in hiring. And I don't know if it's the same as in other institutions. We have many women in operations, but when it gets to faculty and academicians, we get stuck. And in 2020, we had 42% of women working at Kepler from 37% in 2019. So we are making sure that we are progressing. For the data, gender data is observed in every program. Admissions in program, dropouts, refugees, and also access to employment. We make sure that we do observe gender segregated data to help us to take decisions. Thank you.
Thank you so much, Leon. I mean, this is very important, including the data, collecting gender disaggregated and disability disaggregated data, and other aspects of it. Also, I think most importantly, I mean, this is really important. You mentioned one of the things that you mentioned is working with disability structures, associations of persons with disabilities. That can be seen as, one of the strategic areas of higher education institutions, collaborate with one for not only for networking, not only for improving enrollment, but also umbrella organizations could also provide technical support when it comes to their mandate areas, and since they know better the situation, and also when it comes to adaptations on the need. So that is very important. Maybe let me give the floor to any of you if you wish to share also your experiences where you see your organization in this exercise, and why do you rate best, or which area is the best that you rate your institution, and anything that you wish to share. Any of you are most welcomed. Before going to the wrap-up session, I think we can pick few issues here.
Malako, there's a comment in the chat.
Okay.
Hello, everybody. I'm back.
Okay.
From Leon.
Leon, she just finished. Marike?
Oh, I think it's the comment about, I was
Sorry.
saying that students living with disabilities are admitted on full scholarship.
Yeah, that is wonderful. That's wonderful. Maybe any of you, do you have any thoughts around here, or before I hand out, the floor to Dr. Mikias?
Yeah, just to share you our experience. The more you become inclusive, the more applicant, joining your institute. I remember when we start the disability focused scholarship opportunity, the university have less than 1% individual with disability joining the program, the university. But now the number of applicants are increasing over time. So you cannot say that this is over. I don't have capacity to accommodate. But you need to accommodate. But we have to be always, very systematic in order to accepting the applicants every year. So for us, this year we have about 60 individuals having vision impairment in the university. We have about 42 in the scholar program. Do you see? It is 4 or 5 fold every year. So with that, so for curiosity, the more you become inclusive as an institute, then there will be an increment. So it requires, strategical in order to, accommodate all the applicants, just to reflect. And we have a disability affairs officer, a directorate office in the university. We work collaboratively with them, and they are really very supportive, because there are students from the university having disability, and there are students getting scholarship opportunity from the MasterCard Foundation in the university. And there are sometimes conflict of issues because of the equity, because both of them have disability, but one is getting additional support than the other. So this was also another challenge that we encountered while we do the scholarship opportunity at the university.
Thank you, Solomon, for that important remark. Of course, when it comes to inclusiveness, this is a journey, this is a process from the experience that we see, including, as you rightly mentioned it, in Gondar University. Unless you immerse yourself, unless you make basic arrangements and involve students from different walk of life, you can't really finalize everything unless they are there. It's like work in progress. Unless you bring them in your campus, making the basic arrangement, the rest will come. You will learn together with them. You will see each impairment may need a different innovative way of adjustment, handling, arrangement. So and the good thing is, when you open your doors, those few students will attract more of them, more of the same one. So it will eventually make the organization, the institution, field of students from diverse backgrounds, and it's really heartwarming to see. Also, it improves the institutional profile. I know because of the effort the University of Gondar put on trying to include disadvantaged female students and students with disabilities. The university is the leading university over the coming few years in the country. So one of the values, one of the points is its effort and its work on inclusiveness. So that is very important. Unless you have any last minute remark from any of you, question, let me give the floor to Dr. Mikias.
the main supportive thing is around attitudes. If you have a positive attitude and you really want to make sure inclusion will happen and you open the dialogue, then that's the start of everything. And then there's the possibility to change all these barriers that either people with disabilities or women or whoever is the excluded group might face. And as we were talking through the different questions, I had to think also, some of you might have heard about Haben Girma. She's a struggled through universities and the struggles she faced in inclusion. And at the same time, also the success of her managing to finish university and become a lawyer. And it's really good to read. I think in all those examples, as long as you have a positive attitude, you can discuss how to overcome issues. And I think that's the key to any form of inclusion.
I think we've lost Marike. I think the exercise has helped us to, in a way, think about our institution and to what extent these three components of diversity, of equity, and inclusion are considered and thought out in the strategy, procedures, and practices of the institution, which have significant impact for inclusive development. And looking at the results of the Mentimeter exercise, I can see that there is a lot of variation between the participating institution. Some of us are doing well in one area, others are doing well in others. I've noticed that there is some progress, for example, that the University of Gondar has made in promoting disability inclusion, and from the discussions that I also saw that Kepler is making a lot of strides in gender diversity. The same with University of Ghana and HSE making strides. So in some areas we do good, and in some areas that we need improvements, which means that whatever measures that we have to take, it has to be tailored. They have to be tailored to our need, which means that we need to conduct a thorough assessment of our institutions. And the one that we run today, it's a very simplified, and it doesn't take into account, or it doesn't represent the richness of the DEISC or any other scoring cards that we use for the study of, for the assessment of DEI in institutional settings. So we need to include, for example, we don't score our institutions on these parameters using individually, but as a group representing individuals, representing the different units of the university community. So we have three issues as a wrap-up that we need to talk about a bit. One is, what has changed in your perspective regarding the relevance of DEI in institutional audit, and what institutional resources or possible collaborations do we have within this among the participants, the participating in institutions, to further the DEI agenda in the African higher educational system. So the floor is open for ideas. What has changed in your perspective about DEI, and what resources or institutional collaborations do we have to leverage on?
I think it's good to the assessment. The DEISC speaks very much for itself, and it's, as we said in the beginning, is very much disability focused. And it's especially good to, next to answering the question, also really talking about what causes the barriers together with students with disabilities. So whenever you can do an assessment and you can do them together with your students with disabilities, you also get the stories behind what is causing certain blockages. And so I would be a big advocate for including students with disabilities into assessments, and really having those conversations and not only ticking the box. And Melako, you've been more involved directly with the assessment with Gondar University, so I will leave that part to you. Thanks.
Thank you, Marike. Yes, I mean, administering the DEISC is really, it's an eye-opening because it helps us to look into issues that we didn't see. So mostly the domains are similar, but the questions are diverse. And what we do normally is it will, as at the opening, Marike indicated that there are 4 segments of DEISC, and there are different domains, from the strategic planning to up to even staff, office accessibility, partnership with different disability-related institutions, curriculum, and the like. So most importantly, the senior leadership should be there, because the DEISC exercise is not by itself an end, because we will draw action points and with the responsible person. So it would be good to involve senior management team members to take the actionable items further. That's what we did in University of Gondar, where we brought together very senior management members, along with also, from different departments, from the curriculum, from infrastructure, from vice president, So eventually, if it is a practical and pragmatic exercise, we will find the solution for the problems that we identify already. So I see how do we get access to the DEISC? Contact us, and of course, Light for the World is in discussion with MasterCard, to provide this kind of technical support to African higher education institutions within that network. So the resources available within Light for the World different offices. So we can assist in that. Yeah, over to you, Dr. Mikias.
Okay, the organizers are asking me to inform all participants to stay on and to turn on their camera for at the end of the session, and please don't leave without taking the pictures. Dr. Salomon.
Thank you, Dr. Mikias. I think I like the DEISC because it tells us where we are in terms of inclusion, person with disability. It's not only where we are, but also others partner, others institute, and what are their best practice in terms of evaluating their level of inclusion. So for me, this is not only an assessment, but also it gives to be strategic in future, to improve some of the things which is mentioned in the assessment tool. With that being said, I also observed that there are partners who are very committed and have best practice in some of the areas. Like in terms of gender aggregation, in terms of gender equity and the gender analysis and the like. So it's an opportunity for us also to collaborate and make a partnership and learn lesson from others partner across Africa. So I'm very happy to get that lesson, and hopefully the University of Gondar is open to collaborate and work together to create inclusive Africa to be inclusive nation or continent. Thank you. Over to you, Dr. Mitya.
Thank you very much, Dr. Salamon. Do we have questions or ideas that anybody would like to share? I would like to thank everybody for taking part in this interesting engagement, and I would like to thank Malaku and Marike for facilitating this interactive session. Thank you, everyone.